of the passengers on that Dutch cruise ship hit by an outbreak of hantavirus have now been evacuated from the Spanish island of Tenerife. The World Health Organization says 3 passengers have died and there are at least 11 confirmed cases of the virus among those who are being quarantined, and that includes a Spanish national who was evacuated from the ship who tested positive earlier this morning. And a French woman who's contracted the virus remains in a critical condition in a Paris hospital. Let's cross now to France 24's James André, who's at the Health Ministry. James, we're expecting to hear from the French Health Minister in the next hour, but what have French officials been saying in the meantime?
Yes, well, indeed, we are expecting to hear from Stéphanie Rist, who will be holding a press conference here at the ministry. What we've been hearing is basically the French authorities very much on top of the matter. What we have now is a pretty strong protocol that's been put in place by the teams of the Prime Minister at this stage, and of course, the Ministry of Health. Prime Minister who is meeting up with all relevant ministers twice a day at the moment at the Matignon. Has his office in Matignon here in Paris, and indeed protocols that's been tightened through a series of decrees. The Prime Minister, who has made it quite clear yesterday evening that indeed when it came to quarantine, this would take place in hospital and this would not be people just staying at home. So right now what we have is measures that have been taken, and we could listen right now to the Ministry of Health. She spoke earlier on at the National Assembly, giving details about what we know so far when it comes to these hantavirus cases.
On the positive side, there are things we do know about this virus. It's a virus that's been known about since the 1990s, a virus that can spread between people, a virus that can make people ill, very ill, and even cause patients to die. But there are also things we do not know about this virus. For example, where the first person to die contracted it. We do not yet have the complete viral sequence, which would allow us to say with certainty today, even though we're fairly confident at this stage, that this virus has not yet mutated.
And James, you were earlier at the Bichat hospital in the French capital. What is the latest update regarding the French patient who's been listed in a critical condition?
Yes, absolutely. So she is at the Bichat hospital being taken care of. She is indeed in intensive care and very much in a special room. Bichat is has cutting edge technology when it comes to infectious diseases, and she is currently in a room which is a low pressure room, a place where the air is very, very strongly filtered and can only flow out of the room so that indeed no particles or viruses can leave the room when doors are open. It's got a special system with airlocks where doctors enter, change in order to enter the actual room itself, and then they have to change again when they leave, throwing away some temporary equipment they just wear to go inside that room. So this is where this 60-year-old woman is staying right now. There are also 4 other direct contact cases. So these are the 4 other French people who have been evacuated from the MV Hondius ship, and they're also at Bichat Hospital. They're being tested regularly in order to see if they do develop the disease or not linked to this hantavirus. When it comes to the 22 other contact cases that have been listed by the French authorities, these are people who were on the planes with the people being evacuated from the cruise ship. Well, some of them have been located, others not yet. The authorities have asked people to step forward to say if they were on these planes in order for them to be transferred to hospitals nationwide, where they will be kept for 72 hours and checked thoroughly before potentially a longer quarantine that could be imposed in order, of course, to avoid for this virus to actually transmit outside the circle of people who have already been contaminated or been in contact with those touched by the virus.
James